And a very pleasant hello to each and every one of you. Welcome to another edition of Ask the Doc. This is the one and only hope, Shelly-Ann. And as we are all aware of, this is the month of February, and it is American Heart Health Month with the National Heart, Lung, and Blood Institute. And in recognition of that, today, my guest on Ask the Doc is the president, CEO, and founder of the CSB5 group of companies. He's responsible for developing several other centers for advanced health, such as the Breast Center, the Dialysis Center, Bahamas Limited, the Patients Clinical Research Center. There is a list that goes on and on. He's even responsible for centers that were established in Guyana, in Antigua, the Dialysis Center, Bahamas Limited, you name it, and he is a part of it. Anytime we talk about any issues relative to the heart, his name is synonymous with that. Of course, I am talking about none other than the cardiologist extraordinaire, Dr. Conville Brown. Dr. Brown, hello and welcome to Ask the Doc.
Hello, Shelly-Ann. Thank you so very much for having me.
We do appreciate you coming on with us. Of course, like I had established at the beginning, this is National American Heart Health Month. So in recognition of that, we are today talking about the things that deal with the heart. So we want to start, Dr. Brown, at the beginning. I just want to ask you very simply, what is a healthy heart? And Dr. Brown, why do we need one?
Okay, well, Shelly-Ann, I think that's an excellent place to start. And I guess the best way to answer that is to speak to the importance of the heart, because once we know how important it is, then we also know why it's also important for it to be healthy. The heart basically is the engine of the body, and very few other things are going to work very well in the body without a heart that is functioning well. The reason for this is because it helps to pump. It does not provide the nutrients. It helps to facilitate the transport of the nutrients that the body requires, including the removal of toxins to and from the various tissues and organs in the body via your blood supply.
Okay.
And so with that said, if your heart is not functioning well and your brain does not get adequate blood flow to provide oxygen and nutrients, to be able to remove the toxins that are developed as a result of our metabolism and the body's various functions, then the brain doesn't work too well. And you may very well end up being drowsy, sleepy, poor memory, or just not functional at all. Similar applies to your kidneys, your liver, and even the muscles of the body so that you can move around. So the heart is extremely important from that perspective. And even as a cardiologist, sometimes we are biased to say it's probably the most important organ in the body. But the neurologist may argue that the brain is the most important, because if that's not functioning, then who really cares if you have a good heart?
Wow.
So from the perspective of it being healthy, then the healthy heart is one that is, very simplistically put, one that is free of disease, and most importantly, also functioning very well. To be able to allow us to supply all of those tissues and organs of the body.
Okay. Well, Dr. Brown, I want to ask this because many, many times, as it relates to health and health issues, a lot of things can be genetically engineered. As far as a healthy heart, what role does family history or genetics play in a healthy heart or the lack of a healthy heart?
Yeah, it probably plays, well, it should play a big role in both of them, because obviously we can pass on quote unquote good genes as well as we can pass on bad genes.
Okay.
So from the perspective of good health, passing on good genes is helpful. It may not be the all-encompassing feature that is required, because there's so many other things that can affect you outside of your genetic makeup. But if you have bad genes, then it predisposes you to developing heart disease, and various other problems as well. And a lot of those things can be mitigated or made less of an event by doing things that can counteract that, but you're not always able to counteract it. So the
Wow.
genes definitely are very, very important. And we like to speak about the genes and the environment. So with your environment, a lot of that will depend on what you do
Hmm.
to help things along the right path, or what you do to help them along the wrong path. In which case, you exacerbate the particular problem.
Now, when we talk about the environment, I want to dive into that a little bit more. When we say the
Hmm.
environment, Dr. Brown, how much of the environment, quote unquote, relates to, say, what you eat?
The well, the environment, I was referring to a slightly different environment, meaning the
Hmm.
environment that one places one's body in, or the environment that you place within your own body based on what things you eat, what things you do. But
Hmm.
to answer your question, which is not what I was intending, but if we answer that, we can look at things that can literally have toxic effects on our environment. So
Okay.
whether it's too much bad radiation, whether it is toxins in the water supply,
Hmm.
leakage of toxins into the ground that then affects our water table. So all of those sort of things, too much mercury that then ends up in the fish, and we eat fish a lot, and so on and so forth. Not a problem in the Bahamas, but in other industrialized areas. So those things, you can see where the environment can affect what we eat.
Okay.
The Specifically, though, the environment I was speaking of is what people will call, in medical terms, one's internal milieu. Now, let's just set that aside, and we're really talking about what is going on within our own body. And a
Okay.
lot of what's going on in our own body is dependent on what we put into our own body, and what sort of habits we have, lifestyle uh, 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 habits, so to say.
So when we
I hope
talk,
that clarifies the difference.
yes, yes. And when we talk about those lifestyle habits, let's zone in on exactly what it is that you could possibly be referring to. Are we talking about things like smoking and that type of stuff?
Absolutely. So when we talk about these lifestyle things, there's these are the good and bad habits that can that can get us into trouble. And and so for example, um, smoking, for example,
Hmm.
is not a good habit by any stretch of the imagination.
Hmm.
The nicotine can have very irritant effects on our heart, and of course, more importantly, the nicotine and smoking in general can promote the development of atherosclerosis, which is where we end up with these cholesterol deposits in our blood vessels, and it's like messing up the plumbing in your house. So you
Wow.
have several bathrooms in your home. You may have a bathroom in your house. You have uh, a plumbing in the kitchen. You may have it in the washroom, and so on. And everybody knows that if the plumbing gets blocked up,
Hmm.
that area can become dysfunctional or non-functional, and you therefore have a significant problem of inconvenience, to say the least, within your own home or business. And so the plumbing is there for a reason, and if it can't function, well, there's a lot of other things that won't function. So equally so, if you're going to block up your blood vessels because you're smoking, or you eat having inappropriate diet, or one that promotes the development of blockages, lack of exercise, these are the things that we are in control of that can help to promote the development of the disease, or help to promote retarding the disease
All right.
and its onset.
All right. Now, when
And
we
there are several others, of course, but I think
Mhm.
that gets you into the right ballpark.
Yes, yes. Thank you so much for that, Dr. Brown. For those of you that are just joining us, you're tuned in to 1540 AM, Power 104.5 FM, the national voice of the Bahamas, where only the sun covers the Bahamas better. I'm the one and only Hope Shelley, and we are sitting down with Dr. Conville Brown. As you know, February is American Heart Health Month, and we are talking about things relative to the heart. Dr. Brown, we hear these words, thrown around, and I'm wondering if we have a real appreciation for them. When we talk about blood pressure, how does my blood pressure reading affect my heart?
Okay, well, that's an excellent question and one that really deserves to be clarified for our listening community and others. Um, your blood pressure is important to be able, just like in the plumbing in your house,
Mm-hmm.
you cannot take a shower upstairs, maybe not even downstairs, if everybody says to you, what was our complaint in Nassau several years ago? Water pressure low.
Uh-huh.
Okay, so if I like to give analogies that fit real life. So
Mm-hmm.
most of us are familiar with the problem of the water pressure being low. If the water pressure is low, you got a time when you're going to shower, you're going to time when you're going to take a bath, when you're going to wash the car if at all, and so on and so forth. So you're not going to get water where you need water to be if you don't have an adequate pressure head. Likewise, the heart is not going to be able to get blood to the various organs and tissues of the body, brain in particular, um, if it cannot generate an adequate blood pressure. Okay, so and that's why it's important for your heart to be functioning adequately, so it can generate that pressure to advance these nutrients and oxygen and so on to the different parts of the body. And so your blood pressure, when you look at it, it gives you two numbers.
Mm-hmm.
Uh, there's actually three. We talk about the average blood pressure or the mean blood pressure, but we don't need to discuss that. The key two numbers are the one on top called the systolic blood pressure,
Mm-hmm.
and that one is tends to be the higher number. If it's a lower number, we got a problem. So that's the higher number, and the
Okay.
systolic blood pressure is a consequence of the heart pumping. So when it squeezes and it pushes the blood out of the heart, it will generate a particular pressure, normally measured in millimeters of mercury by the machine that we use, and that number is called the systolic pressure. And generally, you're very happy if that's between 110, 120, even 90, up to 120, as long as you have no symptoms of dizziness associated being too low.
Okay.
And anything above that, we start talking about an abnormally elevated pressure. The
Mm.
lower number is called the diastolic pressure. The diastolic pressure is the pressure that the body sees in between the pumping of the heart, so in between the heartbeats. So when it squeezes, that gives you the high number, the systolic pressure, and
Mm-hmm.
then while waiting for the next squeeze, the pressure starts to taper off and it settles down. That period is called diastole or the diastolic pressure,
Mm-hmm.
and that one generally tends to be 70, 80, but less than 90. Okay, so
Okay.
those would give you the general parameters of your blood pressure, but it's as a consequence of your heart being able to pump
Mm-hmm.
adequately, and then it's pumping into these pipes that we call our blood vessels, and depending on how they behave, that pressure can also be elevated or too low.
Okay. Now, we hear a lot about good cholesterol, bad cholesterol. We see the commercials on TV where the cholesterol levels tie directly into a healthy heart if they're at the right level. And I want to ask you, how exactly, do my cholesterol levels affect my heart?
Excellent question. And I will broaden your question
Okay.
uh, because if we go back to us talking about the plumbing and the plumbing affecting needing to get blood to all the different parts of the body, and the
Okay.
heart being the engine or the pump to pump the blood to the different parts of the body, then these pipes, whether they're arteries, arterioles, which are smaller arteries, capillaries, which are the very fine ones that really allow the exchange of the nutrients into the tissues and the toxins to come back in to be pumped into the venules, which are the small veins that become the larger veins and that eventually work their way back to the heart to pump it around the body all over again once it goes back through the lung and so on and so forth.
Mm-hmm.
The All of that intricate plumbing system that we have in our body, go back to what I just said about your house with the plumbing, and the plumbing gets blocked up because our water in the Bahamas is quote unquote hard, meaning that
Okay.
it has a high level of calcium carbonate, and it can therefore create plaque formation or blockages in the plumbing in the house. You're familiar with the concept, yes?
Yes. Uh-huh.
And right. So, and everybody's familiar essentially with that concept, and which is a little different from when we had cast iron pipes and they would just rust unblock. But it's the same problem. Once you get blocked, you're not going to be able to shower on the second floor. Then eventually you can't even take a bath on the ground floor. And the pipes then have to be changed. But it's not so easy to change the vessels in the body because there's too many of them and it's not a practical solution. But those blood vessels in the body can very easily become blocked if our cholesterol, one of the features being our cholesterol, is too high, or the makeup of our cholesterol is such that it promotes the development of blockages. Okay, so that's to say then that you will know that you have good cholesterol and bad cholesterol.
Yes.
And what do we mean by that? The good cholesterol, and I'd like to add one more analogy so that our general public can very easily understand where we're coming from. If we look at the cholesterol as the people in our community, some may say we have good people, we have bad people, meaning we have people that might cause some trouble and people that help to prevent trouble. Yes?
Yes.
And of course, some of the people that may cause a little trouble might actually be considered criminals. And the crime that we're talking about here is not robbing a bank, but it's blocking your vessels. Okay? So when you look at that context, then our cholesterol will have good cholesterol. That's the HDL, the high density lipoprotein, and high density. Just keep the one that's high. You want that to be also high in number, and then you have the LDL or the low density lipoprotein, and that's the one that you want to be low. That helps you to remember who is the good guy and who is the bad guy. Because if you're in society and you have a lot of criminals and a lot of good people, who do you want to predominate? Who do you want to be high in your society? The good guys or the bad guys?
Exactly.
Which one would you prefer?
I would prefer for the good guys to be more
the good guys to be high.
Yes.
Right. So when we go back to the heart and the cholesterol now, the HDL, high density, and remember I said keep the highs together. So the HDL is the one you want to be high, the high density lipoprotein you want to be high. And even if you get which one is the good guy, the one that starts out high with that neighbor high in his name, that's the one you want to be high. Ergo, the HDL, high density lipoprotein cholesterol, is the good guy. So that's the one that you want to be high because that's the one that's going to help to clean out your vessels or help to prevent them from getting blocked in the first place. That's the Drano when it comes to plumbing. They still have Drano, by the way?
Yes, I think they do. Yes, they do. They have that liquid Drano. Yes, they do.
All right. So that's geez, you even know liquids and not tablets. So that's the Drano. And on the other hand now, you have the LDL on the low density lipoprotein. That's the one, again, keeping the highs together and lows together. That's the one you want to be low. So that's the criminals.
Wow.
And if those are the criminals, those are the guys that's going to block your vessels.
Yes, yes.
And if we block our plumbing, we know the answer already. You ain't going to be able to take a shower. You're not going to get good blood flow to the brain. You're not even going to get good blood flow to the heart, for crying out loud, because even the heart's vessels become blocked. So when we talk about heart disease and its relationship to cholesterol, the cholesterol itself doesn't directly affect the heart muscle itself. It affects the blood vessels that's supplying the heart muscle.
Wow.
You follow me?
Yes.
Yes. And that causes starvation of the heart muscle, and therefore it can't function as well. And if you starve anything long enough, what can it do?
It dies.
It can die. And when the heart muscle dies suddenly because of a blockage in those vessels and you shut off the blood supply, then that's what we call a heart attack.
Yeah. It's like a train coming to a full
And in the case of the
stop.
brain, a stroke.
Yes. Wow.
Okay, so the good cholesterol, the HDL, is the one you want to be high. That's the policeman. Okay. That's also what people might call the scavenger, because if you have a tendency to block your vessels, that tends to take those cholesterol particles out of the blood vessel lining and allow the vessel to open up wider so you can get good blood flow. In other words, that's your Drano, and the criminals are the ones that's promoting blocking. In fact, the LDL cholesterol is what exactly gets deposited into the lining of the vessel, and since it happens from the inside, you can see where the passage becomes narrower and narrower, and eventually it may come to the point of total blockage.
Wow, that is just chock full of information right there. And I'm loving the way that you're breaking it down into layman's terms so that every listening ear has a full understanding. Dr. Brown, I want to ask you, I don't know how it can be narrowed down, but I'm quite sure that you can narrow it down for me. We
I hope
hear
so.
we hear the word we hear the word heart disease being thrown around. And I'm trying to
Hmm.
get a full understanding. What exactly, Dr. Conville Brown, is heart disease? What is that?
Okay. Well, excellent question. The When people talk about heart disease, first of all, there are several types of heart disease,
Okay.
and a simple way to look at it is that the heart basically has about three or four major components.
Mm-hmm.
Okay, and then anything that can make these components malfunction or stop working
Mm-hmm.
is, in essence, a form of heart disease.
Okay.
Okay,
Okay. Uh-huh.
okay, just to keep it all simple. So the
Yes.
one that is one of the biggest ones is that if you think about it, the heart itself is a muscle pump, and so if you affect the muscle of the heart, then
Mm-hmm.
that's also one of the commonest causes of heart failure, but also a big cause of the heart malfunctioning. And whenever it fails to do its job properly, that literally is the definition of heart failure. Okay, now
Mm-hmm.
when we talk about these layers, if we come from the inside to the outside of the heart, and if we could put ourselves inside the heart, the first lining we come across is called the endocardium. And we're going to take these big words and break them down because,
Mm-hmm.
us doctors like the big words. But if people aren't understanding what we're talking about with these big words, then we're not exactly communicating. We're talking at them and not with them.
Okay.
So I'll
Mm-hmm.
break each of them down. Endo suggests on the inside. Cardium is that layer of the heart, the thickness of the heart. Okay, so the endocardium is the inner layer,
Okay.
and then we have outside of that we have a layer called the myocardium, and you've heard of myocardial infarction. And so what that means is myo is muscle, uh, the cardium is for heart,
Mm-hmm.
cardiac, cardiologist, and all those words that sound cardiash or cardish. So heart, muscle, myocardium. Okay,
Okay. Mm-hmm.
and so that's the big, thick layer of the heart that actually does the pumping. And then around that, we have it's enclosed in a sac so that the heart can move because it's continually in motion, and you want it to move easily against its surroundings being on the inside of the body, the lung, and so on, and the spine to the back, and so on and so forth. And that's called the pericardium because it's around the perimeter of the heart. Does that make
Okay.
sense so far?
Yes, it does. Uh-huh.
So those are the three main layers. And when we talk about the pericardium, this that gets broken into another category called the epicardium. We won't go there other than to say the blood vessels that supply the heart with blood are not inside the heart, they're on the outside of
Outside.
the
Okay.
heart.
Okay.
Okay, and then they send their branches in through the muscle to
Mm-hmm.
feed the muscle, even to feed the inner lining of the heart. Okay,
Okay.
so those are the big four components of your heart.
Mm-hmm.
Endocardium, which is basically how you get to form your heart valves. And so when we hear about people needing to have a valve replacement, either because
Okay.
the valve is too tight so the
Okay.
blood doesn't go through properly,
Mm-hmm. Mm-hmm.
similar to your plumbing, or it's leaky.
Oh wow.
If you're leaking water, you got a problem. You're going to get a big bill, but more importantly, you're wasting good water. And in this case, the blood is not going where it needs to go because
Mm-hmm.
it's going in the wrong direction from the leak. So the endocardium is what forms the valves, and you've heard of valves having to be replaced surgically
Mm-hmm.
or other techniques that are utilized. The myocardium is the muscle. The muscle can become damaged by lack of blood supply. If it starves, we call that ischemia. If it dies because it starved too much or too quickly,
Mm-hmm.
that's called an infarction, and that is a heart attack, a myocardial infarction. Infarction is death of tissue. Myo is heart. I'm sorry, myo is muscle, cardium is heart. So myocardial infarction is death of heart muscle tissue.
And then, of course, we have the pericardium.
Is-
I'm paying attention.
And then you have the pericardium. And the pericardium can suffer a number of things. It tends not to suffer infarction. It can suffer because of an infarction, because it can become inflamed by the heart muscle tissue underneath or within the pericardium. But the pericardium, from various infections and other toxins, can become inflamed. And then we have, just like you have appendix and appendicitis, that's inflammation or infection of the appendix. So we can get pericarditis, which can be similar from inflammation or from an infection. And sometimes it produces a lot of fluid, and you can get a big effusion or collection of fluid around the heart. And that's called a pericardial effusion. And that in itself can cause problems. So now you can see where, if you look at those four categories, endocardium, valves, myocardium, muscle, pericardium, the lining around, and of course, our biggest killer, the blood vessels themselves having gotten blocked and causing atherosclerotic disease or cholesterol blockages in the vessels and causing angina, discomfort, chest pain, and causing death of the muscle, and so on. Now you can see those are your big categories. And a number of these problems, you can be born with them, and we then call them congenital. And then there are other problems that we acquire as we grow and get older. And that's the predominance of what we see, is the stuff that we acquire and develop as we get older. But keep in mind that a lot of the problems, some problems can be congenital from the time of birth.
I'm glad you made mention of that, because now that leads us into what my next question is. Seeing that a lot of the problems that we would seemingly have with our heart is sounding to me like things that are basically self-inflicted. So what are some of the things that we can do to prevent heart disease?
Okay. The first thing would be, if we determine which things can promote the development of heart disease,
Okay.
then it's easy to say, if I turn left, I'm going to walk into the middle of a gunfight and I could get shot. Well, then common sense says,
Turn
don't
right.
turn left.
That's right. Turn right.
Okay. So or go straight ahead, but
Or go straight.
definitely don't turn left. You might have to go in
Exactly.
reverse. So the point then is that if I know then that smoking, which we alluded to briefly earlier, that smoking can cause and promote the development of heart disease by the development of blockages, then smoking is one of the things that I should avoid.
Okay.
Whether I am personally smoking and I stop, which would be a good thing, or my next door neighbor, next door meaning my partner in my home, at work, if they're smoking and the whole place is smoked up, then I'm getting what you hear people call secondary smoke. Because it ain't from my smoking, it's from somebody else's smoking, but I'm breathing it in. So I'm still being exposed to the toxins in the smoke. All right. So if we were to call out these different risk factors, and risk factors are things that, should you have them, they increase your chances of developing a particular problem. In this case, we're talking about heart disease, so let's stick to that. And so the risk factors associated with developing heart disease, and a lot of them really point to atherosclerosis again, because that is our biggest killer. And so that's where a lot of the emphasis is. There's other things as well. So smoking, we've mentioned already. Alcohol intake is a significant problem. Some people are fairly resistant, but you never know who's going to be resistant. And so for some people, alcohol has a direct toxic effect on the heart muscle.
Okay.
And so your heart muscle can get damaged from alcohol, and you could end up with what we call an alcoholic cardiomyopathy. Now, what does that mean in English? Alcoholic doesn't mean the person's alcoholic. It means the amount of alcohol they take in is such that it is toxic to their heart. And that level is different from one party to the next. For one man, it might be a pint of gin. For the other person, it might just be a sip of whiskey. But the problem is that in that particular individual, and all of us are different, but in that particular individual, the effect of alcohol is toxic. And so alcohol can then cause what I said, alcoholic cardiomyopathy, which means an alcohol-induced cardio, heart, myo, muscle, path disease. Heart muscle disease brought on by alcohol.
All right. I think that's a good place for us to, as we love to say in radio, stick a pen in it. For those of you joining us, we are sitting down with Dr. Conville Brown, who is the chairman, president, and CEO and founder of the CSB5 group of companies, and lots of different companies fall under that particular company. It is another edition of Ask the Doc. We're going to go to our first commercial break. You're tuned in to 1540 AM, Power 104.5 FM, the national voice of the Bahamas. I am the one and only Hope Shelly-Ann. Stay close. And we are back. You are tuned in to another edition of Ask the Doc. Of course, we are in the midst of the month of February, and this is being recognized as the American Heart Health Month with the National Heart, Lung, and Blood Institute in the United States of America. We're sitting down with the gentleman who, of course, is one of the foremost authorities here in the Bahamas as it relates to all things about your heart. Who am I talking about? None other than the cardiologist that everybody loves to love, Dr. Brown. Dr. Brown, yes, yes, yes. We are going to continue on. We were talking about heart disease right before we went into our first break, and we talked about cholesterol, and we even talked about some of the things that we can do as individuals to prevent possibly developing heart disease. Now, I do want people to understand the difference. I don't want them to confuse heart disease with heart failure. Dr. Brown, what's the difference?
Okay. And remind me, Shelly-Ann, to come back to some of those things that can cause heart disease. But
Okay.
but let's answer that question. So, heart disease can be defined as the heart and its function being impaired by an area of the heart not functioning as well as it ought to.
Okay.
And and we started to say that there was four layers to the heart, and so you can have very many things causing heart disease. Okay, so whether it's blockages, whether it's inflammation, whether it's a viral infection, including in this COVID era, whether it's I think I mentioned alcohol already, whether it's dietary, whether it's trauma, and you damage one of those layers or more that we spoke about earlier, like the gunshot wound, a injury, and so on and so forth. Those things then give you heart disease. It does not necessarily mean you've gone into heart failure. However,
Okay.
now, so the when the malfunction of the heart gets to the point that you are no longer able to maintain forward flow of blood and your blood pressure as well as is needed for you to survive and do well, that is what we call heart failure. So it doesn't mean that the heart just stopped beating and the heart failed in that manner, even though that's one of the consequences. But the primary meaning is that it is failing to provide for the needs of the body by not being able to pump blood as well as we would like it to.
Okay.
And
Now,
that's heart failure. And it's associated with a number of symptoms. Some of them related to not pumping enough blood forward, others related to blood becoming congested in the heart because the heart is too weak to pump it out. And so the heart gets overfilled and so on. And so the classical word was congestive heart failure. And the congestion leads to swelling of the legs, fluid in the lung, inability to breathe. So you can see people having shortness of breath. But when they're not able to pump the blood forward, then the muscles don't get fed. And fatigue is also one of the features, not to mention lethargy, laziness, you don't want to do things, you can't think straight because your brain is not also getting the blood flow that it requires because your heart is failing to provide for it. So
Okay.
hopefully, in a nutshell, that clarifies the difference between heart disease, where you are at risk of developing heart failure,
Mm-hmm.
and heart failure, where you have already manifested inability to provide for the rest of the body.
Okay. Now, of course, we do want to step back, Dr. Brown, into heart disease because this is where everything starts. And I have a few questions relative to that. Once a
Certainly.
person once a person has been diagnosed with heart disease, what types of changes do they need to implement into their lifestyle? Like, for example, do they change their diet? Should they limit their fluid intake? Is there an issue with salt? Can we talk briefly about that?
Yes, we can, and that's an excellent comeback to the point because when we were talking earlier about these quote unquote risk factors, the things
Mm-hmm.
that produce the heart disease, once you
Okay.
identify those, and once your patients or once a public, I'm sorry, I keep speaking of patients, but once a
Yes.
public is aware, then they know which things they need to modify and or avoid. So a lack of exercise, for example, can promote the development of heart disease. Too much alcohol, tobacco, the wrong diet, a diet that is high in fat, high in carbohydrate that leads to obesity, high in and or the development of diabetes. These are things that help to promote the development of heart disease, and again, particularly the form with the blockages in the blood vessels. So the wrong diet, high in saturated fats and trans fatty acids and so on, bad diet. People say you are what you eat, right?
Yes.
So these are the
Yes.
things that help to promote the development of heart disease, and therefore criteria can be put in place to say what things we should avoid, modify, or eliminate from our lifestyle. And so you want, if you're going to drink alcohol, you want to do it in moderation, and the smaller the individual, the less alcohol they should take in. But generally, you can say, based on muscle mass and so on, and men tend to be bigger than women in some parts of the world, anyhow. We can say that two drinks, and by two drinks, that's two glasses of beer, or two shots of whiskey, or two glasses of wine. And we're talking regular glasses now, not the big glasses that's the size of a bucket.
That's
Um,
right.
that two of those in a male should be their limitation per day, and
Hmm.
one in a female should be her limitation per day. Okay. And of course, the low salt diet, because we have so much high blood pressure in our community, and high blood pressure is one of the main culprits in terms of damaging the heart. So there's a ton of risk factors that we need to modify. There's a big risk factor called genetics. We spoke about that earlier, where your family history can be one of the most potent risk factors in you. But but the other ones are also contributory, and in great part because a lot of our heart disease is acquired through our lifestyle,
Okay.
self-inflicted, as you said earlier.
Yes, yes. I'm loving how, Dr. Brown, you are letting us know exactly the difference between heart disease and heart failure. And I'm now understanding that, certain things that I can do can contribute to heart disease,
Absolutely.
which then of course can translate into possible heart failure. I want to take us now into the area where someone has suffered heart failure.
Mhm.
What are some of the treatments for that? Like, do they take medication for the rest of their lives? Are there natural remedies, um, or nutritional supplements? What can actually help them at this point after the heart failure has happened?
Okay, there's several things, and it's a multifaceted approach,
Mm-hmm.
meaning multidisciplinary, many different angles that need
Mm-hmm.
to be addressed. And a lot of it can even be a fair psychological component because a lot of this requires you changing your lifestyle. And that is not easy. What they say, it's hard to teach an old dog new tricks.
That's
So if
right.
you've been doing something all your life, it's a
Mm-hmm.
little challenge for a lot of people when the doctor says you really shouldn't do this and you really shouldn't do that, and they go like, really? And
Mm-hmm.
so
Mm-hmm.
the Again, when you look back at the same risk factors that caused the problem in the first place, those still need to be modified. And let's just leave that under the umbrella of lifestyle changes that
Yes.
need to happen to not promote the aggravation of your heart disease and or your heart failure. But once you're in heart failure now, you may have a problem where you're not getting enough blood to the tissues and where you're congested because the heart is unable to pump forward adequately. And in fact, the blood may be sitting in the heart and not, in other words, if your muscle is too weak, how's it going to pump the blood out?
Exactly.
Okay, so you need a finite amount of strength to pump it out, and so if it can't get it out, then you're going to get congested. And now we better hope our kidneys are not being damaged, so they're working reasonably well. Because one of the things we would use is what's called a diuretic, which is a medication that will help us to pass urine. And in
Yes.
passing that urine, some of the fluid gets to leave the lung and allow you to breathe better so that the shortness of breath improves. And a classic medicine that most people have heard of is Lasix. Okay,
Yes.
and
Uh-huh.
and when you take that, it makes one pass urine like a racehorse. Okay, so that, but the reason for it is not just to make you pee; it's to get the fluid out of your lung and a lot of times out of your legs, where the places where you see the swelling. We also sometimes will use medicines that make it easier for the heart to pump blood forward. So
Mhm.
there's two things I can do if I'm trying to pump blood forward and my heart muscle is weak. I can either try to strengthen the muscle, and we have some medicines that work very well in that regard, as well as I can make it easier for the heart to pump the blood forward. So if there's an obstruction, remove the obstruction. And so we use medicines that can called vasodilators, vessels that will open up the tight vessels that would have been clamped down. It can open up those, and it then allows less resistance to blood flow, so it makes less work on the heart that's already compromised, if that makes sense.
Yes, it
Okay,
makes
so
absolute sense.
there's a ton of medications. Don't forget the lifestyle changes where we
Yes.
have to not aggravate it, where we
Mm-hmm.
need to do things to not make it worse, where we don't go and drink a gallon of water every 5 minutes, and as we pee it out, we're going to put it right back. Doesn't make a lot of sense. So we need to control our fluid intake, and of course, you still want to try and maintain a level of exercise that's consistent with one's capacity, but that will also help other things to work well in the body. Now, when medicines alone don't work, we then sometimes have to look at other procedures and interventions by your physician and or surgeon, etc., that can help things to be better. So, for example, if you have a leaky heart valve or a very tight heart valve, then the valve may need to be repaired surgically or
Mm-hmm.
by an intervention where we can put in a balloon and we can open up a blocked valve. That's called valvuloplasty, and that can be an interventional procedure as well as sometimes the valve needs to be replaced, and that tends to be done surgically by a heart surgeon. Okay, so we have lifestyle changes, we have medications,
Mm-hmm.
we have interventions,
Mm-hmm.
including one that's commonly done if you have a heart attack from a blocked vessel. We can go in and we can perform what's called angioplasty.
Yes.
Angiovesoplasty is plastic surgery on that vessel. You basically open up the blockage and sometimes put in a stent that will then keep the blockage open and
Mm-hmm.
allow the blood to flow through. And I like to break the words down so it just makes it easy for the general public to understand.
To
And
understand.
sometimes we have to do bypass surgery on those blood vessels.
Mm-hmm.
So if there's a bad car accident on Collins Avenue, God forbid, and you're trying to get from Wolf Road to downtown,
Mm-hmm.
well, going onto Collins Avenue ain't going to help you too much if it's
No,
blocked.
no, it's
So
not.
what would you then do? So what would you do if you still have to get
You
downtown?
have to go around it.
Yes, and going around it says don't go on Collins Avenue, hang a left, go to East Street, or hang a right and go to Mackey Street
Mm-hmm.
and then approach downtown. That's called bypassing the blockage
Mm-hmm.
in order to get downtown. So the
Mm-hmm.
tissue that is being fed by that vessel that became blocked, let's find another pathway to get blood to that tissue. And that's what bypass surgery is.
All right. Well, Dr.
Makes it
Brown,
easier to explain like that.
yes, it does. I mean, it's easier to understand, and then all of these terminology that we've heard our lifelong time. We now actually understand what they mean and what they translate into. We're going to stick a pin in it right there. And Dr. Brown, we're going to ask you to hold on. And of course, the public, 1540 AM, Power 104.5 FM. We are the national voice of the Bahamas. You are tuned in to another edition of Ask the Doc. And we are sitting down with cardiologist Dr. Conville Brown. And we're talking about all things that deal with the heart. We'll take this final break and be right back. And we are back. Dr. Brown, the last segment, we concentrated a lot on what everybody needs to be aware of, and that is as it relates to any issues within your body, inclusive of your heart. A lot of what you go through has to do with your lifestyle. We're going to leave that right there for just a moment. And I want to ask you something else as it relates to heart failure, because that's the last thing that we were talking to. Some people think about, often wonder about, and ask the question, as a result of me having suffered heart failure, can I still be sexually active?
And the answer is absolutely. So you
Okay.
have, when we have heart failure, if you are in florid heart failure, meaning you have difficulty breathing, you can't walk 10 steps without having to stop, well, then sexual activity can be uh, uh, a rather active exercise. Yes. And
Okay.
so clearly, you're not going to run up the hill if you can't breathe. So the key thing is to make sure that if you have a diagnosis of heart failure, that you do the things that have been advised, you follow the instructions of your heart specialist and or your physician, and you do the things that allow your heart failure to become what we call compensated. In other
Mm.
words, if you have heart disease that has caused heart failure,
Mm-hmm.
and we have not been able to remove the heart disease or cure the cause of the heart failure, then you the best we hope to do is then get you in a compensated form where you're able to function, including enjoy your sexuality. Okay?
All right.
So, and we try to get you to the point where you can enjoy as much as possible, as close as possible to your regular lifestyle, not including the bad habits, of course. We still
Of
want to
course.
discourage those.
Mm-hmm.
So you want to, if you are decompensated, that's when you're very symptomatic. That's when you have all the shortness of breath and all the swelling, and you can't lay flat at night, and you feel like you're drowning, and life is just miserable. And let me be very clear: getting a diagnosis of heart failure can be a death sentence. If your heart fails and continues to fail, that ultimately is how you may die. So
Yes.
it is not a diagnosis to be taken lightly.
No.
That is not to say that we can't do things and we can't be sensible and smart about it. So there are very many things that can be done, but the person most important in that entire relationship is the patient. The doctors, we can give advice, we can
Mm-hmm.
do things to help them fix the problem, but you have to maintain. So when patients feel he ain't gonna know that I put extra salt on the fish and on this and that and the other, and
Hmm.
he ain't gonna know that I continue drinking. Well, hey, who are you fooling? I'm
Yourself.
not jumping in the grave. I'm not jumping in the grave with you. We can advise you.
That's
You're going to
right.
be going into that grave by yourself. So we can
Mm-hmm.
advise you and help you to not jump in that grave earlier than you need to.
All right. I
All
want
right.
to.
But you want to stay as compensated as possible. And that has many things. And then one more thing I should mention, because you did ask the question about natural remedies. Natural remedies, I'm not an authority on that area, but what I
Okay.
can say is that, you know, even penicillin came from bacteria. So there are things that are there, whether it's of animal origin or plant origin, that absolutely is a benefit. The challenge is when people displace that which we know to work with something that has not yet been confirmed
And not
through
even knowing.
appropriate clinical research.
Yeah.
That is a danger, in my opinion, and so I think people need to be careful when they say, "I'm going to stop my medicines because I'm just going to take some natural medicine," and the good Lord goes with them when they do that. That's not the approach I recommend, but that I will tell you right now that there are clearly things out there in Mother Nature that can provide for natural remedies and or treatments, and some of them may be even better than what we have. But I don't know which, and
That's
that's the
right.
problem. Most people don't know which. But to say that it's not possible to find it, absolute foolishness, because a lot of what we have has come from Mother Nature once it's been discovered and then proven to be a benefit in the general community before it is unleashed as a good and conventional therapy,
And of
if that
course,
makes sense to you.
in what quantity? I think that's a challenge too,
Absolutely, too,
because
because the same applies to your medications. If you listen, too much oxygen is a problem.
that's
Who would have
right.
thought that oxygen could hurt you? Too much water can
It's
be
a
a problem.
uh-huh.
All right. So, too much of anything, there's a reason they say it was too much because it caused an adverse effect. So, too much and too little, those are the problems that we have to deal with. Whether we have too much exercise and we injure ourselves, or whether you have too little and we end up with blood clots, there's just, you have to get that balance, and the balance happens in every aspect of the risk factors that we have addressed. Whether it's our cholesterol, and of course, because you have good and bad cholesterol, how can you take too much good cholesterol,
Wow.
right?
Amen
So,
to
so,
that.
but there has to be a balance.
There has to be a balance, definitely so. I know that we are running out of time, but I do have to fit this in. Dr. Brown, globally, we are, of course, still in the midst of a COVID-19 pandemic. For
Yes, ma'am.
patients that are listening in, and by extension, heart patients that are listening in, how does this affect how does their condition affect their ability to be vaccinated, or is there no effect whatsoever? What should they do? What guidelines should they follow as far as deciding whether to be or not to be vaccinated?
That's a very interesting question. I think there's a much bigger question, but to remind me, hopefully we'll have a minute or two to come back to it. And that's actually the effect of COVID on your heart itself. But
You
but
can
if we
tie
take that
that
first
in.
category that you asked about, people that have cardiovascular disease and whether or not they should get vaccinated, well, if you have something that can kill you, okay, which COVID has already proven that it can kill people, and there's people that's going to be at risk, and anybody that has significant comorbidities, meaning they have other illnesses or other conditions that further predispose them to the ill effects of additional diseases, then you might want to make sure that one of the things you don't do is get COVID.
Ah,
And there's only two ways to become immune to COVID or any other illness. Either you get the disease and develop your own immunity. And as we've seen, a number of folks, when they get the disease, they don't get to develop immunity because they become deceased. They pass.
uh-huh.
Or you get vaccinated. Those are the only two mechanisms I'm aware of. Vaccination, where one tries to administer um, an attenuated form of the virus or bacteria, whatever it is, so that you don't get a full blown disease. You may get a mild form, but most importantly, you develop your immune system is triggered to develop resistance to that illness. And the other form, of course, like I said, is to roll the dice. And if you get the disease, you may be one of the unfortunate ones that succumbs to the disease. So when it comes to the heart failure patient, they're no different from anybody else, except that they already have a comorbidity that's a challenge, and so they should be equally concerned, not more concerned. They should be equally concerned about what can happen if they were to get COVID. And since we're talking about COVID in particular,
Yes, yes.
what can happen if they get COVID, which by itself can cause heart trouble, by the way, but which can happen if they were to get COVID with their comorbidity and increasing their chances of that particular adverse outcome, versus if they were to become vaccinated and be somewhat protected. And I say somewhat because nothing is 100%.
Of course not. And how does let's go ahead and tie it in. How does COVID-19 affect your heart?
Uh, we are still learning, and
Mm-hmm.
that's a big question, Shelly-Ann. We are still learning of all the things that COVID can do in the human body, period. But when it comes to the heart, equally so. So the big things, and if we go back through those layers we talked about earlier, if we go straight to the heart muscle, COVID is a viral infection, and viruses have been known to be able to cause what we call myocarditis. Now,
Mm-hmm.
let's break it down again. Myocarditis. Myo is muscle, cardium or card, heart,
Mm-hmm.
itis, inflammation. So if the COVID virus were to cause, infect and or inflame the heart muscle, that's myocarditis. And a myocarditis can have adverse consequences, including cause death
Mm-hmm.
by abnormal rhythms, by the development of congestive heart failure. It can cause pain and so on and so forth. Um, your your pericardium can also become inflamed, and so you can end up with pericarditis as a result of the COVID infection. There's even a syndrome called, well, let's not get into the name of the syndrome. The simple name for it is broken heart syndrome, and
Mm-hmm.
the broken heart syndrome is where the body undergoes a massive and major stress, and in the process, the heart can decompensate, and that's called a broken heart syndrome, and that's a real reality. So outside of Valentine's Day, you can still have, well, that might be another cause of broken heart syndrome, but outside of Valentine's Day, you can actually have certain viral infections, certain trauma, emotional and otherwise, and physical, that can lead to this broken heart syndrome, and that is also being described in relation to COVID infections.
Mm-hmm.
But and then some of the sequelae are that people can end up with shortness of breath, easy fatigability, which can be directly related to the heart or indirectly related just from the COVID. And of course, the palpitations, where a lot of patients will complain of rapid heartbeats, abnormal heart rhythms that can be somewhat bothersome to them, but that hopefully don't lead to anything malignant.
All right. Well, Dr. Brown, we have basically come to the end of the show, but you have another minute. Is there anything else that you just want to put out there for the Bahamian public to know relative to their heart?
I think, thank you very much, Shelly-Ann. This has been a pleasure. I think something I've been saying, this is now my 32nd year home. And one thing I've said from the beginning to now and shall continue to say is that the most important person in taking care of your health and your heart, which is very important for your health overall, is you, the individual whose heart is in question. Obviously, for children, it's our parents and our guardians that have to help guide us and what we do. But us as adults now need to really take the bull by the horns and do the things that we need to do to maintain an appropriate lifestyle, to
Mm-hmm.
minimize the things that do us damage and injury, and
Mm-hmm.
to promote the things like exercise and eating healthy that helps to promote good health. So the heart is no different. It's our biggest killer. Let's be very clear. It is our biggest killer. I think second, and cancer comes in second. And the good part is that a lot of the things that we do for good heart health are also good for good prevention of cancer
All right.
health. Okay.
All right.
So I say all of that to say that our community,
Mm-hmm.
children, adults, older folks, all of us, I'm now getting into the older folks category, we have to educate ourselves and then be guided by the education and our physician and healthcare professionals' advice.
All right. Well, I think that's a fabulous note for us to end on. Ladies and gentlemen, you've been tuned in to 1540 AM, Power 104.5 FM, the national voice of the Bahamas. And we were sitting down with the chairman, president, CEO, and founder of the CSB5 group of companies. We were sitting down with cardiologist Dr. Conville Brown. I want to thank each and every one of you for listening in. Everyone, please have a splendid day. Bye now.